Hello and welcome to Ask the Experts by Salinas Valley Memorial Healthcare System. I'm Claudia Otero from the Communications Department at SVMH. Today we're focusing on diabetes. Thank you for joining us. If you have questions about this disease, please take the time to write it in the comments section, and at the end of this presentation, our experts will answer those questions. And speaking of experts, I do want to introduce you to a couple of very important people. We'll begin with endocrinologist Dr. Nicholas Cassell. He is the medical director of SVMC Diabetes and Endocrine Center in Salinas. And joining him, this is really the dream team here, joining him is his colleague, registered dietitian Mireya Lopez. Thank you for being here with us today.
Thank you, Claudia, for having us.
Thank you.
Thank you. Well, we're going to have a very interesting half hour. Again, I repeat, for those of you joining us right now, make sure that you tell your family members, your friends that this is live. You can ask those questions. We'll be answering at the end of this broadcast. Well, before we get started, SVMC Diabetes and Endocrine Center is part of SVMHS. It is located at 355 Abbott Street in the Prime Care building on the second floor. Dr. Cassell, besides treating patients with diabetes, what other illnesses or disorders do you treat at this clinic?
So we treat all hormone diseases. We treat menopause, osteoporosis, hypo and hyperthyroidism, pituitary disorders, adrenal disease, and patients with low testosterone.
And does a patient need a referral in order to make an appointment with you or some of the other physicians there?
They do not. Patients can self-referral. We accept all insurances, and we also have a charity program for those who don't have any insurance.
Very good. Thank you for that information. So I do want to get started with diabetes, and Mireya, feel free to jump in here, but I'm going to begin with Dr. Cassell. What is diabetes, and what are the different types of diabetes?
So diabetes is a chronic disease characterized by high blood sugar levels that over time can cause complications and affect other organs in your body. There are three main types of diabetes. Type 2 diabetes is a disease characterized mostly that adults have it, but we're starting to see more children have it as well. And this is when your pancreas is starting to work harder and harder, and the insulin is not utilized properly. Our pancreas is our organ that produces insulin, and think of insulin as the key that lets sugar into the blood, into the cells. And if we're not able to utilize that properly, then the sugar builds up in the bloodstream and can cause damage. Type 1 diabetes is a disease by which our body attacks the pancreas, and our pancreas is not able to secrete insulin. So patients with type 1 diabetes have to be on insulin for the rest of their life. And gestational diabetes is when there are high blood sugars in pregnant women. And this can lead to congenital malformations or having a big baby at the time of birth.
Okay. Do we know exactly why some women develop gestational diabetes, and how often do we see this?
It's fairly common. We don't know why some women develop it and others don't. We know that being overweight is a risk factor, or having a family member that had gestational diabetes. It's very important to diagnose gestational diabetes so that we don't have those congenital malformations. Most women are screened at 28 weeks with an oral glucose tolerance test, and patients that have been diagnosed with gestational diabetes actually have a significant increased risk of developing type 2 diabetes later in life.
How do you treat a mom-to-be with gestational diabetes? I mean, how do you go about that?
So usually we start working with food choices, and they may see Mireya or one of our other nutritionists. Insulin is typically the main form of treatment for high blood sugars in pregnant mothers.
Okay, thank you for that information. It's very interesting. What are the signs and symptoms you, or maybe your child, your spouse, has developed type 2 diabetes?
So I sometimes refer to diabetes as a silent disease. Many patients don't even know that their blood sugars are elevated, and they may not seek prompt medical attention. When the levels get very high, patients can be very thirsty, they can experience blurry vision, sometimes they're urinating more frequently during the day and at night. Some have profound weight loss and severe fatigue, and these are the signs and symptoms that should be a red flag and make you contact your doctor for testing.
Okay, that's good advice. Speaking about the importance of paying attention to the signs and symptoms of diabetes, one of our patients was very kind and he has a message. He actually wants the world to know what happened to him and basically why it happened. So let's watch this 2-minute video. I think you'll enjoy it.
I was born at Salinas Valley Memorial Hospital in 1954. The hospital just had opened the year prior. My mom told me she could still smell the fresh paint. I'm 65 years old. I was diagnosed with type 2 diabetes in 1989. During all those years, I didn't pay much attention to it. No fruits, no whole grains, none of that. I ate at McDonald's, Wendy's Burgers, all of those fast food places. The doctors told me I had 4 blocked arteries and that I needed open heart surgery. It was gangrene. The infection made its way to my leg bone, and the doctors had to amputate my leg just below the knee. I suffered my last heart attack in April 2019, and as a result of that, my kidneys failed. Now I have to undergo dialysis. If I had attended those classes a long time ago, I probably wouldn't have suffered 2 heart attacks. My kidneys would still be working and I would still have my leg.
He has changed his diet. Now he chooses healthier food options. He eats more whole grains and he tries to be more active. He now comes once a week to my class and makes a 20-minute presentation to my patients, sharing his story. His objective is to try and help those people so they can understand that this can happen to them. People are shocked when he takes off his prosthetic leg and they start to think that this can happen to them.
The healthcare providers that took care of me at Salinas Valley Memorial Hospital are very professional.
Mireya and Dr. Cassell, you must be very proud of John, and I do want to thank John. If you're watching, thank you so much for letting us share your story. I think a lot of people are learning a very valuable lesson there, so thank you.
Yeah, thank you, John, for sharing your story.
Yeah, and obviously he discusses some of the complications that he's been having or he's had. Obviously he lost a leg, he had open heart surgery, quadruple bypass. What other complications does diabetes cause?
Sure, diabetes is the leading cause of blindness in the world. You can develop kidney failure and have to go on dialysis. Diabetes leads to poor wound healing. That's particularly important when you were not to feel your feet, you get a cut, that cut spreads to the bone, and then there's an infection, then there's risk for amputation. High blood sugars also can cause heart attacks and strokes, and again, I think John's example, someone who's had many of these complications, he made the decision to change his lifestyle around to get his diabetes under control, and he's going to prevent further complications from occurring.
Okay, it's something that you can control. You just have to learn how to do that and have the tools available, right? Is there a cure?
So unfortunately, there's no cure for diabetes. Patients with type 1 diabetes need to be on insulin. They have different forms of administering that insulin. Some patients take daily injections, some wear insulin pumps. We also have these new pumps, I brought one to show today, that allow patients to deliver insulin easier. We're working towards an artificial pancreas. That's the ultimate goal. but we're not quite there yet. Patients with type 2 diabetes can have diet and exercise controlled. That's essentially the goal. If that's not sufficient, we have oral medications, non-insulin injections, and insulin. There is a myth out there that insulin causes lots of problems, and that's simply not true. Insulin is our body's normal hormone that controls blood sugar levels. So sometimes patients' diabetes is so uncontrolled that they need to be on insulin, and that's okay, and that's important to know.
Okay. So when a person is diagnosed with diabetes, whether they're a child, a teenager, a young adult, or a little bit older, their life really changes. Mireya, what can you tell us about that in terms of nutrition, lifestyle, because you're very involved when it comes to this.
Yes, this is where I come in, the dietitians and the educators come in. And one of the things is there is no one cookie cutter way. Diabetes is individualized. And the thing is that food affects a person differently, right? So we want to make changes, small changes, but that make a big impact in a person's life and wellness. So we do encourage people to have balanced diet, and I'm going to show you here. The plate method is one of the easiest ways to follow because the plate method, you know, people can relate to it. We encourage patients to try to eat as many non-starchy vegetables as they can. Half of the plate should be of vegetables. I encourage patients to try new foods because if you just stay stuck eating the same things, you might get bored. So that's also where we come in, give you ideas on different things to try, different recipes. Then 1/4 of your plate should be with a lean protein, fish, chicken, turkey, beans if you're vegetarian. And then you have to include healthy carbs. There's a myth that carbs are bad for you, and I think that you need to just try to focus on including healthy carbs with higher fiber, more nutrients. So a balanced diet is the key to, you know, healthy lifestyle and managing your diabetes. There are no bad foods. I don't like to, you know, separate into good and bad foods. I think there's just better choices that you can make when it comes to your diet.
I think it's important that we also live in moderation. We're realists. If it's your birthday, you might have a smaller piece of birthday cake. And we are a center that doesn't shame people for high blood sugars.
Yep.
It's very important that everyone know that their disease is individual to them. Yep. And we have ways to help individuals. And it's important for our patients to know that when they come and say, yeah, I splurged a little this week, and that's okay. Diabetes, it's hard to live with diabetes. And we are focusing on behaviors, and Mireya is leading the cause in really changing the idea of food. But again, everything in moderation.
Yeah, we try to meet patients where they're at. You know, that's, I think, the key to the success of a person moving forward. And not making them do things that maybe they're not ready for, you know. So don't be ashamed of your diabetes and look for help, you know.
Yeah, that's a great point.
Good advice. For those of you joining us just now, thank you for being here with us. We are speaking with Dr. Nicholas Cassell from SVMC Diabetes and Endocrine Center and with registered dietitian Mireya Lopez. Obviously, we're discussing diabetes. If you have any questions, please type those up in the comments section at the end of this presentation. Mireya and Dr. Cassell will answer those questions. In our community, are there certain groups who are at a higher risk of developing type 2 diabetes, and why is that?
So unfortunately, there is some ethnic groups that have a higher or greater risk of getting diabetes, which is African Americans, Hispanic, Pacific Islanders. And I think, like Dr. Cassell touched on it, you know, one of the reasons is higher weight, you know, obesity, and then lack of exercise or sedentary behaviors is probably one of the highest risks that puts these ethnic groups, you know.
We can't change our genetics, but we can change our lifestyle.
Okay. Tell us about some of the services that you offer at the SVMC Diabetes Endocrine Center.
We offer one-on-one classes, diabetes classes. We offer, obviously, support with some of the best providers here in the clinic. We give medication support. We have trainings with pumps and all the newest and latest technology for diabetes management. We have social service support, and then we also behavioral health referrals that we can provide our patients.
And I would argue that our classes are second to none. We have patients like Mr. Ibarra who have had diabetes forever, and they come, do the classes, learn something that they didn't think of before, had never been taught, and apply it to their life. And these little changes that Medea talked about make profound impacts. And that's what we want to see. We want to see little changes to help patients control their diabetes.
Very good. And I do want to point out that Dr. Cassell and Medea, as well as other members of their staff, are bilingual. They're fluent in Spanish. So some of these classes that Medea mentioned are done in both languages. So that's fantastic. Spread the word, right? Let's switch gears a little bit. Tell us about the Pediatrics Diabetes Clinic that's within the SVMC Diabetes and Pediatric Center.
So the pediatric clinic was opened in 2018. And one of the reasons that they opened the clinic is to facilitate great services to the patients, the pediatric patients that otherwise, is not available in this area. So the same services that they receive at UCSF or Stanford, we have a great clinic here for them. Having a new diagnosis, makes it challenging for people with diabetes, and so we provide the one-on-one support with a nurse practitioner and with an endocrinologist also for the pediatrics. We provide help with their medication management, and we also provide other services to help with the management of new technology.
Imagine being a 10-year-old patient with diabetes, having to be taken out of school to travel an hour and a half to 2 hours. The fact that we have the center here in Salinas for patients in Monterey County is incredible. It helps families not have to travel and to have that local support to make it just a little bit easier on the whole entire family.
Sure, that's an excellent point, Dr. Cassell, because you're not just taking the child out of school for that entire day that they would have to travel to the Bay Area, but mom and dad or just one of the parents has to not work, right, if they do indeed work. So you have a day of PTO, or maybe you just don't have PTO, but you lose a day of work and then you take your child out of school. So this is really a great service to the community for the entire Central Coast, really. What else can you tell us? I mean, are we seeing an increase in diabetes in children? How alarming is this? I mean, what can you share?
It's troubling. Right now we're living through a pandemic, but we also have an obesity epidemic, and we are seeing more and more patients with type 2 diabetes that are children. Years ago, we used to classify diabetes as adult onset or juvenile diabetes, and those numbers have been by the wayside because we have children. I think the youngest in our clinic is 2 years old with type 2 diabetes. And we have patients who are adults that are becoming diagnosed with type 1 diabetes, which we used to think of as a juvenile. So it's very important that we reach out to the community, to schools, to really focus on that 60-minute of exercise a day that the American Academy of Pediatrics recommends, healthy eating and lifestyle changes to prevent the development of type 2 diabetes.
And I think that some of the changes, when I see a pediatric patient, I always address the whole family because it's not just for the child. This has to be a change that happens for the whole family. So I really try to work with changes, for the whole family.
Because you're not just educating the person with diabetes.
And you can't just single out a child, or a patient. I think that getting the support from everybody that's around is going to make the success, better.
Okay, it's not just about educating that person with diabetes, it's bringing the whole family so that
awareness.
They can move forward and have a good transition, right, and better care and control. Is for parents watching who may have a child at home who maybe, may be diagnosed or has already been diagnosed and they want to come to this clinic, do they need a referral from their pediatrician? How does that work?
So for the pediatric program, they do need a referral from their pediatrician, but we are able to accommodate all of these referrals. And again, I think Medea touched on the fact that we have so many services provided to not just the patient but the entire family to get them through this challenging time, because it's scary for the parents as well. especially if the child has to inject insulin and has to wear continuous glucose monitor. It's scary, and we want to be able to alleviate some of those fears for our patients' families.
Okay. So when we were planning for this event, you sent me a list of questions. These are myths or about diabetes. Mythbusters is what we're calling them, right? So I do want to read a few of them. I think it's important. Let me begin with you, Dr. Cassell. Insulin causes people to go blind, lose their limbs, and lose their kidney function. So this is insulin. What do you have to say about that?
Right. Yeah, we hear that all the time. Patients are so fearful of injections, they will do whatever they have to do to not go on insulin. And at the same time, their blood sugars are still way out of control, and they're starting to develop these complications. And I try to go back to let them know, your pancreas produces insulin. Your body, unfortunately, is not utilizing it properly. So it's not the insulin that's causing the problem, it's the high blood sugars. And the insulin is a way to correct those high blood sugars.
Okay. Here's another myth. Type 1 diabetes is the worst type of diabetes to have.
Yeah, I think that plays in a role with insulin, as patients with type 1 diabetes have to be on insulin. Some people generally think, okay, well, that must be the worst kind. Well, that's not true. Both types of diabetes can be well controlled, and we can prevent those complications. They're really two different diseases, even though they have the same name, diabetes. But again, it's a myth that there is one type that's worse than the other. Uncontrolled diabetes leads to complications, and these complications can be devastating.
As we saw with John Ibarra there in that video that we saw a few minutes ago. Here's another one. Mireya, eating nopales and cinnamon helps cure diabetes.
That is incorrect, because like Dr. Cassell, there is no cure for diabetes. And I think that one of the things that once patients start eating nopales, they see a difference in their blood sugars, but that's because nopales is a vegetable. And maybe, now they've made a transition from what they used to eat, which was maybe bacon, eggs, pancakes with a ton of syrup and butter. And now they're eating a vegetable, a non-starchy vegetable, which helps to lower their blood sugars. So they see that correlation, but they don't think about like, oh, it's the lifestyle change that I've made in, including healthier options in my diet. And cinnamon, there is no scientific evidence to show that cinnamon cures diabetes. I think, I'm not sure where people got it from. It's easy to incorporate in your diet, so it doesn't hurt, but it does not cure diabetes.
Okay, and this is another popular one. All carbohydrates are bad for someone who has diabetes.
That is absolutely incorrect. Carbs get a really bad rap, and it's very unfortunate because carbs are the food group that gives you energy, and I think that you just need to distinguish and know the different types of carbs. There's carbs that are a little bit healthier for you. There's other carbs that may will increase your blood sugars. So knowing the difference between having whole wheat bread or having a donut, they're both carbohydrates, but the donuts will definitely raise your blood sugar the most. Or having fruit versus 100% fruit juice, which juice will definitely raise your blood sugar because there's no fiber incorporated and your body will absorb it more. So, and it's also the amount of carbohydrates that you have, because people will stay away from rice. And the first question for me would be like, how much rice are you having? Are you having 3 cups of rice versus a half cup of rice? There is, better alternatives like having 100% whole wheat, whole grain rice, or brown rice, or having quinoa, having wild rice. There are better options. So it's the amount that you also have, which makes a difference. But no, all carbs are not bad, or people should not stay away from carbs.
The driving factor for type 2 diabetes is being overweight or obesity. Mm-hmm. And I had a patient recently ask me, well, what can I do different? I'm a vegetarian, and this patient had uncontrolled diabetes and was obese. And I said, it's the amount that you're eating is contributing to your weight gain, mm-hmm. which is in then making your type 2 diabetes worse. So it's important that people use the plate method, have a balanced diet, but also portion control is very important for good weight management.
Okay, so carbs are good, not necessarily bad, and portion control. Okay, here's one final one. People with diabetes who have to, do they have to follow a special diet?
There is no special diet. Like I said, I think that you have to learn, you know, what your body, how your body reacts to different foods, and that there's always ways to improve, you know. And talking to a dietitian would definitely be a good thing, you know, for somebody to do.
Okay. I do want to dedicate some time now to answering some of our viewer questions. I have Murad Maria. She says, this is a comment, I look forward to going to my appointments with Mireya and Dr. Cassell. Thank you for watching. And thanks for that comment. She also says, a very supportive group. We have Gabriela Lopez. She says, what is a good range for A1C? But can you also explain to us what is
Absolutely.
A1C? So
the A1C is the marker for blood sugar control, and we use that to say if someone has well-controlled diabetes or if their diabetes is out of control. And to diagnose diabetes, your A1C has to be above 6.5. And we want the A1C to be below 7. If it's below 7, then patients are doing great. We know that the studies have shown if we can keep our A1C below 7%, that will allow us to prevent those long-term complications. So everybody's different. Everyone has a slightly different A1C goal. If maybe it's a little higher if they're older or have other medical issues. But generally speaking, we like to get that A1C less than 7%. When we talk about our patients checking their blood sugar at home, we want their fasting blood sugars in the morning to be less than 140 and less than 180 after eating. That is a good range to be in. Every time you eat, your blood sugars will change. They're going to go up. So we want the range typically to be between 70 to 180 the majority of the time.
Okay, well, thank you for answering that question, Dr. Cassell. I have one more comment here on Facebook. Lupe Cabeka says, Dr. Cassell is the best. I've been to him since I was 25, and I've never felt as good as I have the last few years that he's been my doctor. So there you go. I think we're about to wrap it up now. Is there anything else, Dr. Cassell and Mireya, that you would like to add about diabetes, other illnesses, perhaps COVID, since we are slowly making our way out of this pandemic? Anything else that you want to add?
Yeah, I just want to finish with two things. Having diabetes is very hard. We ask a lot of our patients. When a patient has a heart attack, their cardiologist says, take several pills so that you don't have it again. We ask our patients, check your blood sugar, take your medications, go to our classes, eat sensibly. And at times that can be overwhelming. But we mentioned before that there's no shame in having diabetes. We work with our patients. I think our patients say that it's a welcoming environment. And it's okay to struggle, and we're going to be there for you. Okay. With regards to the pandemic, diabetes is not necessarily a risk factor of contracting the virus, but it's very important to keep social distancing, wearing a mask, washing your hands, because diabetes and obesity are the two highest risk factors for developing complications from COVID. So that's extremely important to keep maintaining social distancing.
Mireya, anything else you'd like to say?
I would say thank you for tuning in. And if you're struggling with your diabetes, please look for support, because we're here. We're more than happy to help you in any way that we can. We're, I think, very determined and just very welcoming, like Dr. Cassell, and we just want to help our patients get through and just manage their diabetes the best that they can.
Absolutely.
Okay. Good advice, and thank you for that. And I do want to thank Dr. Nicholas Cassell and Mireya Lopez for sharing so much valuable information, and also for answering some of these questions. We really appreciate you being here today. The SVMC Diabetes and Endocrine Center and the Pediatrics and Diabetic Clinic is located at 355 Abbott Street in Salinas. For more information about services or to make an appointment, please call 831-422-3636. I repeat, it's 831-422-3636. This video will remain here on our Facebook page. Please like it, share it, tell all your friends and family about it. This is what it's all about. So thank you so much to our experts, and thank you for watching.
Thank you.
Thank you, Gloria,
Take
for
care.
having us.